It really is an accident of history that revenue cycle exists the way it does. And, my dad is a physician, and I vividly remember, going to the hospital with him and watching him sign charts. And the charts at that time, this is, I guess, late 80s, early 90s, were stacks of paper in a manila folder. And that represented the record, right? We didn't have EMRs, we didn't have that system. And you had to find a way to compress all of that data into something that you could meaningfully fax to payers in order to represent the care that was provided. And the system that was created to do that was using diagnosis codes that rolled up to this concept we call DRGs, or diagnosis related groups. And that system has persisted through to today, even though we have now electronic medical records and AI and much better systems of being able to understand the patient chart. And that sort of like accident of history is the complicating factor, right? And that's why the system exists. And we hope to do at SmarterDx is simplify it over time and make it a little more sane. But as a physician, like Mike and I, we don't think in terms of ICD-10 codes when we're seeing patients, right? Like that is just not how we think. But we've yet, because of how the system evolved, we are forced to bill in terms of ICD-10 codes. And that inherent like switch between how doctors think and how the system has been forced to operate like leads to the complexity and why you need technology to really try to solve it and round out those corners.